What if you could see your doctor directly? No middlemen, no insurance red tape, and no surprise bills. And instead of waiting weeks for an appointment, imagine having a doctor you can reach directly. That's the idea behind direct patient care, or DPC for short. In our current healthcare system, most doctors' offices and hospital groups contract with insurance companies. That means almost everything about your care, from how long your appointment is, to which medications are approved, to whether you can even get certain tests, depends on what the insurance company decides. It can feel like your health is being managed by a third party instead of by you and your doctor, because, well, it kind of is. Direct patient care removes that middle layer, so healthcare decisions are made between you and your doctor directly. It's a model where you pay your doctor directly for your care. Decisions are made between you and your physician, the two people who matter in this relationship. The best thing about direct patient care is that it allows for longer patient visits since insurance is not involved. This means no longer trying to squeeze everything into a 10-minute visit. Your time is valued and your health isn't dictated by a checklist. Let's be honest, it's nearly impossible to talk through all of your health concerns in a 10-minute visit once or twice a year. And if you get sick in between, you may end up waiting weeks or even months to be seen. In direct care, you typically get longer visits, and you can often see your doctor within a couple days and sometimes even sooner. Communication is direct. No call center, no layers of messaging, and that might mean that you see your doctor in person or even connect by phone or telehealth when it makes sense. The focus is always on access and a real relationship with your physician. Another benefit of direct care: no hidden fees. We all know the feeling of going to the doctor only to be surprised by a bill months later. The same goes for imaging. And if you try to be proactive by asking how much a test or medication will cost, you often still can't get a straight answer. With direct care, that frustration disappears because there are no hidden fees. You can call your doctor's office and schedule the appointment. Instead of your visit being billed to insurance, you pay a flat monthly fee. And that payment covers your time with the doctor and often includes follow-ups or direct communication. If you need labs, imaging, or procedures, those are arranged separately. But many practices are able to negotiate discounted prices with local labs and radiology centers to keep costs transparent. The bottom line is, you know the cost before you walk in, and there are no surprise bills showing up 3 months later. And that predictability brings peace of mind to a lot of patients. Of course, direct care isn't a replacement for everything. Insurance still plays an important role, especially for emergencies, surgeries, specialty visits, hospital care, and expensive medications. So having supplemental insurance is recommended. After years of working in the traditional insurance model, I realized that healthcare cannot be managed in 10 to 12-minute visits a couple times a year. You deserve to be heard and deserve more than a band-aid to treat your conditions. Healthcare is complex. Treating conditions usually means understanding the cause, making lifestyle changes, and sometimes using medications. That can't happen in a rushed traditional model. And that's why I created Sakinah Health, so I can help patients live their healthiest, most energetic, and confident lives. And to do this, we need time to talk, to figure out what's been holding you back, and what we can do to improve things one by one. This requires time in a true patient-physician relationship. At Sakinah Health, I help patients with weight management and obesity medicine, hormone optimization, and improving lifestyle habits like nutrition, movement, sleep, and stress. In direct care settings, we can take the time to explore the root cause, create personalized plans, and adjust as needed without the pressure of a 10-minute clock ticking down. So, with direct patient care, you get transparent pricing, so you know what you're paying up front. You get more time with your doctor, not just a quick in and out, and you get easier access when you need it. You also get a focus on prevention and long-term health, not just checking boxes for insurance. And most importantly, the physician-patient relationship is restored, just like it used to be. Direct patient care is about putting the focus back where it belongs, on you and your doctor, working together to improve your health. If this sounds like the kind of care you've been looking for, make sure that you visit sakinahhealth.com to join our priority list today. I'm excited to help you on your healthcare journey.